A gentleman we love and enjoy being in his company, though he tries to trip us every single Tuesday with some terms that are getting more and more difficult, more and more difficult to pronounce.
Pemphigus Vulgaris.
Don't play you saying that. You know you were just here stumbling all over it.
I wasn't either.
Good morning, Dr. Andrew Ford. How are you today?
I'm great.
This lovely World Heart Day.
Yeah.
And he's still upset that he didn't get any pepper pot either.
Yeah.
Yeah.
Well,
Put
it's
some in the fridge for me.
people.
Timing is everything, Dr. Ford, you know?
Yeah.
So let's get to the heart of this matter as we get into our skin. What are we talking about today?
We're talking about Pemphigus vulgaris.
Thank you for saying it.
Pemphigus refers to blistering, and vulgaris means that it's common, but actually it's a very rare condition. It occurs maybe 1 to 5 in a million people.
Okay, this is what it looks like here. I'm seeing.
Yes, it's a blistering condition that gives you superficial blisters that affect the scalp, the face, the upper body, and the blisters are so soft that they tend to lose their top and give you what's called erosions, where the upper surface of the skin is missing. So you just see the area underneath.
Open sore, that sounds more serious than not.
Yes.
And it is painful.
Well, it can be uncomfortable. It's like almost having a burn. If you got burnt with some hot water and you get a blister and lose the surface, it's a similar injury at that level. It is not very common, but the mouth is one of the most common areas. 50 to 70% of individuals suffering with pemphigus have mouth involvement. So you get little erosions in the mouth, and that can be very uncomfortable, especially for eating and other activities. But you know, it affects the skin and the mucous membrane. So not only the mouth is involved, all the orifices of the body can be involved. And this is just a close-up of one of the blisters just before it's about to pop on someone's hand.
Wow.
So I have to let the viewers know that viewing blisters may not be the most pleasant, but it is a reality, so it's something that we have to show you. And it affects a lot of people between the ages of 15 and upwards. So you can have lots of blisters on the body, very uncomfortable.
You said 15 and
upwards? 50.
Oh, 50, because I was going to ask you, why is it so prevalent in middle age?
Well, we don't know. It's one of these autoimmune conditions, and in an autoimmune condition, the body tends to attack its own tissues. And the reason why that happens is still a mystery to us, but in these individuals, the body tends to attack the desmosomes, which are little connections between the cells and on the surface of the epidermis. So when you attack those connections, what happens is that the cells break apart and you get lots of fluid underneath, and that's what causes the clinical signs.
Can people mix these up with bed sores?
Well, the pressure points can be involved, but usually you have other areas of involvement. As I said, the mouth is very common and elsewhere. So you wouldn't present with just erosions in the pressure areas. So it's unlikely to confuse it with that. But there are some other conditions that look similar. There's another one with a funny name called bullous pemphigoid, and there's also something called erythema multiforme that you get from taking some sorts of medications. But just to say that there are other conditions you can confuse them with. So in order to make the diagnosis, other than the clinical picture, sometimes you need to do a test, which is called a biopsy. So by doing the biopsy, you can look at the skin under the microscope and see where the blister is. And also there's some special tests called immunofluorescence where you can highlight where the immunoglobulins are, the immune particles are. So there's some ways of determining it definitively.
How do you settle or calm your patients when you say biopsy? I mean, they may think, could this be cancerous? What do you want?
Well, we wouldn't mention cancer, but it's just a matter. There are many blistering diseases out there, so sometimes it's best to do it. And once you explain to the patient that's what you want to do, and the therapy will depend on the result, then they're fine. But a biopsy is always something that an individual would be highly motivated to do because it's usually done in order to come up with the exact answer.
For the benefit of the Morning Barbados viewers, what are the early signs of this condition? Because obviously this doesn't start like that.
The earliest sign, you don't get itching or any signs like that. There may be a little redness, and then you notice a little fluid-filled swelling, but it ruptures very early. But the earliest signs can be the mouth, and sometimes individuals can present with only mouth symptoms, in which case they usually present to their dentist, or they may go to their general practitioner. But if it's only in the mouth, it can be more difficult to diagnose unless someone's aware that it's one of the most common manifestations of this condition. But once it starts on the skin, it becomes very simple for a dermatologist to make the diagnosis.
There's a cream that you put apply to
You mean as far as the treatment?
The treatment,
well,
yeah.
the treatment involves preventing the infection that occurs from having the top of your skin missing, also trying to heal it. So you get topical applications and wet soaps that can contain disinfectants and or saline, but also the main treatment is oral steroids or sometimes topical steroids if it's just localized to some areas.
Okay.
But the treatments can be very complicated, you know, intravenous immunoglobulins, which is like an immune intravenous treatment. Also other medications that help to reduce the amount of a steroid you have to take, and so it's making it a more healthy treatment.
Okay, so why does this happen? Is it viral? I don't recall your pointing
Well,
out.
in some
genetic? What?
well, there are some other forms of it, and you know there's some that are associated with having an occult cancer, which means a cancer that can't be easily detected, and you can break out in this in some rare instances. There's some that tend to run in families that can be stimulated by something as simple as an insect bite. And you know, any autoimmune condition can sometimes be triggered by a viral infection. So autoimmune conditions are still a baffling thing for us, but we do know that if we use things that work on the immune system, we can usually treat them.
I'm curious though about the condition in the mouth. It must be more difficult to treat, much less to detect.
Well, you have some paste that you can use and gargles that can contain the corticosteroid, and also disinfectants, or sometimes you can take an antibiotic like doxycycline and make a liquid that you can treat it and stop the infections. So,
but the eating exacerbated?
Yes, definitely. This is one of the problems. Before we had oral corticosteroids, over 99% of people with this condition used to die. But having the oral steroids now has reduced the rate of death to between 5 to 15%. And of course, if you have it and it's going all the way down into what Bajans will call the swallow pipe or the esophagus, it can be a very painful condition to have. And if you have it, you can have it in the eyes, the covering of the eyes, the conjunctiva, and that can cause problems with the vision. So if you have it in other orifices, let's say the opening where you'd go to the bathroom with, or any other opening, you need to have some multidisciplinary assistance to sort it out.
Thanks for pointing that out, Dr. Ford. So, well, this doesn't sound like something you can ignore and let go and treat.
No, it depends on the severity. If it's only in the mouth, you might be able to tough it out. But if it's involving the skin and the other openings of the body, then it'll be very significant.
What else exacerbates it?
Well, pressure. There is a sign that you use which is not specific to the condition, but where pressure on the skin can extend the blister or the detached area. So pressure is definitely something you should avoid. Pressure on the skin.
What about pre-existing
contact sports, things
health
like that?
conditions?
Well, if you have parts of the surface of the skin missing and you're diabetic, then your infection probability is raised a great deal. And also, if you're diabetic and taking an oral steroid, your control of your blood sugar is compromised even worse. But this is a case where controlling the condition is of utmost importance. So you'd have to have an alteration in your medication during the treatment.
Okay, is it contagious?
Fortunately, no, it isn't contagious.
That's good.
And as I said, it doesn't occur very often.
Thank goodness.
I'd say I've seen I've seen only 5 or 6 cases over an 18-year period, so it isn't very common here.
Excellent. All right. Well, I hope you feel a little more informed. I mean, we always like to take things like our environment into consideration. Did we discuss how much that could impact on it?
Well,
weather?
Well, fortunately, it doesn't impact directly. But of course, being comfortable is important if you're missing the surface of the skin.
Okay. Thank you very much, Dr. Andrew Ford. It's always interesting. And just in case you missed the name,
Pemphigus vulgaris.
That's what I said.
Vulgaris.
Pemphigus vulgaris.
I always get so nervous, and then when that happens, the words don't come out right. So we're going to take a short break here, and we're going to talk
breakfast time.
World Heart